Hey guys, it's Devin from 509 Therapy Hub. Wanted to go over a common question that I get a lot from stroke patients, and it's talking about vision. Sometimes people will get what we call left homonymous hemianopsia, where half your vision goes away because of your stroke. Sometimes it gets confused with left neglect or left inattention, so I kind of wanted to do a quick visual demonstration of the two and how they're different. So if you look at our form here, we have our two eyes, our left eye, our right eye. We're looking above as if we're looking at the top of someone's head and seeing what they see. So it's kind of like I'm looking like this. So we have our visual fields that each eye picks up. So if you're looking and there's two pens in your field, you're gonna see both those pens. What happens after a stroke, depending on where the stroke happens in the brain, usually this would be on the right side, kind of center of the brain, which is a common area for strokes to happen. So you get these visual field cuts, we call them. Nothing happens to the eyeball's intact, it's just the vision doesn't make it back to the brain to be processed. So you'll have the left half of each eye will be like it's not getting anything. So if you cover one eye, you're gonna have half the world that you can't see. And same thing with the other. So it's like this, if now the same thing, if there's two pens in my field of vision, this one's not going to be visible because it's in this area that's not picked up, that doesn't overlap with the right eye, and so, or the right side of either eye. So the vision, anything here, if someone says, hey, can you grab that red pen for me? You're going to look at them like they're crazy because you literally will not see this pen until you turn your head and it gets picked up by some of the other fields of vision that are there. So the right side of your left eye will pick it up because you move your head. But if you just kept your head stationary and just didn't move around at all, you would literally not see that pen there. The right side of your vision is going to be fine because a lot of it's kind of covered by the right side of each eye. But you do get a little weird spot kind of in the center of your vision that will be gone because our nose blocks the right side of our left eye. So there's a spot kind of here that won't come up. So with driving, you're going to have a spot kind of right in the center of your vision, and the left peripheral is going to be completely gone unless you're turning your head to pick up for it. So sometimes people talk about this as if it's neglect. Neglect is completely different. That's where your brain doesn't recognize the left half of the world. We'll go over that later in another video. But for vision, the homonymous hemianopsia is where the visual input from your eyes is not getting processed by the brain because of where the brain hit, or the stroke hit in your brain. And it affects the tract because our vision has to go from the front of our head clear back to the back. So we'll do more videos later, and hope you have a great day.